But first, around 330 million Americans, 1/10 of the country's population, live with diabetes. Medical guidelines for treatments include a healthy diet, exercise, and regulating blood sugar levels. As with many diseases, there are also unproven treatments that have produced anecdotal success stories. From iNewsSource, an independently funded nonprofit media organization, Cheryl Clark reports.
Dillon is a small rural town of about 4,000 people in southwestern Montana's Beaverhead Valley. Here, everyone knows everyone, including Ron and Julie Briggs. 4 years ago, Ron, the county coroner, was ready to give up on his longtime fight with diabetes. We spoke with them in December.
I've been a diabetic for 55 years. I have heard from everybody under the sun, everybody's got a cure for diabetes.
His diabetes was so severe, he often landed in the local hospital in a diabetic coma. But Ron's wife, Julie, would not give up hope.
And I thought, you know, we've worked really hard, and I don't want my husband to die now.
At a particularly low point in 2014, Julie started searching online for diabetes treatments. She discovered a national network of clinics called Trina Health. It was founded by Sacramento lawyer G. Ford Gilbert, who said he had developed a miraculous procedure to treat diabetes.
When you have extra insulin and
Gilbert insisted in a February interview with us that his treatment stops, even reverses, the complications of diabetes. Here's how he explained the results.
you get your brain functionality back, you get eye functionality back, you get kidney functionality back, you resolve unhealing wounds that have been unhealing and weeping for years.
The 4-hour procedure involves infusing insulin into a patient's bloodstream through an IV. Gilbert said the infusions, as shown in this Trina video, help patients better metabolize carbohydrates, and that restores their health.
Any person who truly understands what we do is wildly impressed and enamored with the outcomes we achieve.
But many in the medical community are not convinced. Dr. John Buse, a former president of the American Diabetes Association, was blunt in his criticism of Trina when he spoke with us.
The pitch was pretty slick and compelling, whereas the evidence that I could find was pretty much non-existent.
In 2016, at the request of a potential Trina investor, Buse spent hours reviewing Gilbert's materials.
You know, I would sort of characterize it more on the scam end of the spectrum of business opportunities.
Medicare and at least one major insurance company say they have found no sufficient evidence that the Trina treatments actually benefit patients, so they won't pay for them. But Gilbert had a workaround. Instead of billing the Trina treatments as one all-inclusive claim, his company submitted claims for each of the services separately. Ron Briggs began receiving Trina treatments in 2014. He and his wife thought they found an answer, if only for a while.
I found something that would help with my situation. And it wasn't I thought would help, I knew would help.
Ron traveled every week to a clinic in Scottsdale, Arizona to get the infusions.
After the 4th time, Ron called me up on the phone and he said, I don't know what we're going to do, but I have to do this the rest of my life.
So Ron and Julie rallied support in Dillon to open their own clinic. They said they paid Ford Gilbert about $300,000 for fees and equipment. The couple tried to persuade Dillon's local hospital and its doctors to oversee it, including Dr. Sandra McIntyre.
And part of that conversation was, would one of you in this organization be the medical director if the Briggs chose to move forward? And we pretty much said the same thing, which is why would we be medical directors over a service that we don't think has scientific merit?
The doctors recommended the hospital not get involved. McIntyre said when patients like Ron have a chronic disease, they look for anything they think will make them feel better.
And when someone offers something that really is painless, essentially, and cost-free to you, with this promise of a miracle, it hooks patients, it hooks them.
Without the support of hospital doctors, Ron and Julie opened their clinic anyway in 2015. They hired nurses to perform the insulin infusions and treated as many as 15 patients. 2 of those patients said Trina was miraculous and even extended their lives. But not all thought their health improved. Some, like Ruby Monty, suffered severe side effects from the treatment process.
It was more than severe diarrhea, and I just couldn't handle it. I was getting dehydrated, and I'd come home and my husband would tell me that I just looked washed out.
Over the past 5 years, more than 24 Trina clinics have opened in 17 states. But by early 2017, Blue Cross Blue Shield of Montana was questioning the Dillon Clinic's reimbursement claims, and the private insurer and federal authorities were investigating Gilbert's billing practices. Gilbert told us he did nothing wrong.
There's no fraud. There's nobody a bad actor here.
But Blue Cross Blue Shield had already been refusing to cover Trina treatments in Alabama. Eventually, the insurance companies stopped payments in Montana. That decision led Ron and Julie to close their clinic.
I've invested $750,000 in this whole thing. We were told the insurance companies were in line.
You see on TV, you see all of these things about this medication. If you take this medication, your legs are going to fall off and your arms are going to fall off and your nose is going to turn blue and it's going to kill you. And the insurance companies are covering all of that. But something that helps and has saved my husband's life, they don't even want to look at.
But Ron's life wasn't saved. In late December, he told his wife he didn't think he'd last the night. He wound up in a hospital with kidney failure, heart disease, and a blood clot, all possibly related to his diabetes. Days later, Ron died. When we spoke with Gilbert weeks later, he remained committed to expanding his network of clinics.
We will achieve remedial treatment for hundreds of millions of people. And I say that without a worry in this world.
But in April, Gilbert was arrested on federal public corruption charges in Alabama. He is accused of fraud and bribery in a failed scheme prosecutors say was intended to get a state law passed to force coverage of Trina infusions.
And very adamantly and respectfully pleaded not guilty.
A state legislator and lobbyist were also arrested. All 3 have denied the charges and await trial. The clinic in Dillon remains closed. So are clinics in Mississippi, Alabama, Louisiana, and California. Others have shut down their websites or stripped away the name Trina. But some clinics continue to offer the unproven Trina treatment and to advertise that insurance and Medicare are covering it. How long that will continue is unknown. For the PBS NewsHour, I'm iNewsSource reporter Cheryl Clark in Dillon, Montana.